MedsPLUS Consulting Pharmacy and Wellness Center, you're not just a number. We offer individualized care for each of our patients, plus prescription delivery and medication management.
MedsPLUS is there for any and everyone who wants a special touch with their pharmacy needs.
Call or visit today for a free consultation.
Bringing the pharmacist back to the community, MedsPLUS Consulting Pharmacy and Wellness Center.
Visit MedsPLUS Consulting Pharmacy and Wellness Center in downtown Birmingham at the new South Federal Building.
Hello, everybody. Happy Monday and welcome back to MedsPLUS Medical Minute. I'm Dr. Pauline, and we missed you last week. You may have noticed that we were not on last week. We actually had an unexpected emergency in our building, and because of that, we were not here on Monday. But we're back, and we're just in time for the busiest and most exciting time of the year, back to school. Many of your students have already started school. I've seen on social media, some of y'all are taking kids to college. So today we're covering everything families need to know about going back to school, but from a health perspective. So whether your child is going to preschool or heading off to college, we're here to talk about vaccines, wellness checkups, mental health, healthy habits, and more.
That's right, Dr. Pauline. Going back to school is not just about the sniffles. It's about setting up kids, teens, and young adults for a successful, healthy school year. We'll break this down into three main groups: preschool and elementary, middle and high school, college and beyond. And for each, we'll share key health tips that parents, caregivers, and even students themselves can take action on today.
Yeah, so let's start with talking about preschool and elementary. And this will fit for me because I have, my son is now in second grade and he started a new school this year. So very exciting times for us. So when your child is in preschool and elementary school, there are a few things you want to be sure. The first is that they're up to date on their immunizations. So you want to make sure that your child has had every immunization for his or her age. And that may include things like Tdap, which is like the whooping cough vaccine, measles, mumps, and rubella, that's MMR, varicella, which is chickenpox, hepatitis A and B, the polio series, as well as their annual flu shot. Now, flu shots, we realize, are now starting to become available. We typically recommend flu shots in September, but that's something you want to keep on the radar. You want to make sure when they're available for your child, everyone 6 months or older gets a flu shot. The second thing for our elementary school or preschoolers is vision and hearing checks. A child who can't see the board or hear their teacher clearly will struggle in school, even if they're trying their best. So make sure you get their vision checked and their hearing checked to optimize their education experience. And the last thing is just creating healthy routines. We want your child to have a consistent bedtime. So elementary school students need at least 9 to 11 hours of sleep per night. You want them to have a nutritious breakfast every morning, whether you're making that at home or they're able to get it at school. And then you want to make sure they use healthy habits such as washing their hands before and after using the restroom, after using the restroom and before they eat their meals.
Okay, so next up, I'm going to talk about middle and high school. So preteens and teens, this is a stage where they become more independent, but so do their health risks. So first, we're going to talk about the recommended and required vaccines. The first one, meningococcal vaccine, the first dose should be given at ages 11 to 12, and then a booster at age 16. The HPV vaccine, it starts at 11 to 12. Also, their annual flu shot and their Tdap booster if they have not already received. Now, this is a time when they're heavy into sports, so they'll be getting sports physicals as required. So if they're in athletics, make sure that they've had their physical checked for their sports, and for their heart health, checking for any injuries or any other risks before the season starts. So still time for that. Now, we all know that there was a bill recently passed for children in schools. not to be on their phones throughout the day. So the next thing we're going to talk about is screen time and mental health. So outside of school, we want to encourage limits on recreational screen time to protect their sleep, their mental health, and posture. I'm not sure if you've noticed, but some kids, when they're on their phones, they're kind of slumped down. So now what they're doing is they're getting incorrect posture. So we want to make sure that they're sitting upright as much as they can, so as to keep that muscle intact. Next, we want to be alert for signs of anxiety, depression, or even bullying. So that can occur in person or online. So make sure that you're having conversations with your children, particularly with this new bill that was passed. Although some school systems didn't require phone use, now everyone is not allowing phones in school. So kind of talk to your children, kind of see how their day has been going. You want to be able to foster that open communications so that they know that they can come to you without any judgment. Healthy habits. Keep nutritious snacks available. Healthy foods don't just show up in your house. You have to be intentional to shop for snacks or little carrot sticks, veggie sticks, something that they will enjoy. Also, encourage hydration, especially during sports and with this hot weather, because it is coming back.
Absolutely. Yes. Hydration is so important. And now we're going to talk about our college students. So we're going to talk about our young adults heading off to college, whether they're staying local, maybe going to UAB or Miles, or they're moving away and you're moving them into a dormitory. The first thing is you want to make sure they have up-to-date health records and immunizations. This is important because many colleges require the student to receive the MMR vaccine and the up-to-date Tdap. So if they haven't had a Tdap in the last 10 years, you want to make sure that they get that before they head off to college. And if they haven't had a meningococcal vaccine, they want to get that before they head off to college. You also want to check with your college to see if they're going to require COVID-19 boosters. As we've said before, they're changing some of the requirements for COVID-19, and just want to check with your student's campus to see if it's required. Lastly, you want to make sure that they have an up-to-date copy of their medical records and insurance cards. Unfortunately, we know that accidents, things happen on campus, and we don't want to lose critical time in an emergency looking for medical records. So make sure they have that, especially if they have a chronic disease or a situation where a health professional needs to know what's going on with them. Another thing we want to do for our young adults is make sure that they have healthy lifestyle skills. So by now they should have been taught how to grocery shop, how to prepare simple, balanced meals. We want to make sure that they have healthy sleep habits. We were all in college once, and we know, drinking the coffee or drinking the energy drinks just to stay awake and study for tests, that is not healthy long term. So let's create healthy skills now so that when push comes to shove, our students are prepared to do well and excel without being a detriment to their health. And then make sure they stay active. So it's important, a lot of times kids get activity walking to and from class, and that is great, but make sure they join things like intramural sports. Find a fitness club on campus where they can remain active and healthy. And just as with our high schoolers, we want to support their mental health. This is a very critical time for our young people as they're becoming adults and learning responsibility. So just make sure that they know where the counseling services are on campus if needed. Most campuses have some type of health clinic and counseling service, so make sure they connect and join with that. Recognize the signs of burnout and make sure our young people are prioritizing self-care. So it's important to know when things are becoming a little bit too much. Check in with your students, phone calls, FaceTime, pop-up visits, if they're close enough. Go and check on them and see how they're doing. And then make sure that we stay connected with them with friends and family for that emotional support. And finally, make sure they have a first aid kit on hand. So things like Band-Aids and gauze and Tylenol, ibuprofen, make them a little healthy to-go box as they head off to college so that they know what to take and when. And then know where to go for urgent care that's local and their pharmacy needs. Already have a plan because, again, when an emergency happens, you don't want to lose critical time searching for places to go.
Absolutely. So as you can see, guys, back to school is more than just the new backpacks, fresh notebooks, new clothes, gear. It is also an opportunity to set the tone for a healthy and productive year. Whether your child is 3 or 23, these tips can help protect their health and their well-being all year long and set them up for a successful academic school year as well.
Yeah, and so remember, we here at MedsPLUS, your pharmacists, are your partners in keeping your family healthy. And we can help you with immunizations. We can help you with immunization checkups to see where your child ranks, if they've received all the immunizations that they're due. We can help with medication management and even health education for college-bound students. We wish all of our students and families a happy and safe school year. Until next week, be well and stay healthy. Have a good day, everybody.
At MedsPLUS Consulting Pharmacy and Wellness Center, results matter. Don't settle for less when it comes to your health. Empower your health journey with a pharmacy that puts you first. Transferring your pharmacy is easy with our guidance. Plus, we offer prescription delivery and medication management.
Bringing the pharmacist back to the community. MedsPLUS Consulting Pharmacy and Wellness Center.
Visit MedsPLUS Consulting Pharmacy and Wellness Center in downtown Birmingham at the new South Federal Building.